Reality of the virus's lethal strength.
Have you been briefed by the CDC?
I have.
Are there words about a pandemic at this point?
No, we're not at all, and we have it totally under control.
Days after the virus hit New York, on March 11th, the World Health Organization declared COVID-19 a global pandemic.
Tonight, with the U.S. now leading the world in the highest number of people testing positive for coronavirus.
New CDC guidelines recommending the wearing of
We saw the first case of COVID-19 in Washington State in March 2020. All of a sudden, businesses and schools had to close down. Most people thought the lockdown wouldn't last long, maybe a month. Now it's July 2021, 18 months have passed, and the pandemic continues, here and around the world. The community at Yesler Terrace is adapting to the dramatic changes brought on by COVID. It's been a very hard year. Not only have we been isolated in our homes, but our youth, like millions of others, had to study online. Some of our parents lost their jobs and many risked infections because they couldn't work from home. The story of Yesler Terrace is the story of America. What this pandemic has made clear is that low-income communities and people of color have been disproportionately impacted by COVID. This film speaks about the psychological impacts of COVID-19 on our youth at Yesler Terrace.
Yo, what's good? Can't believe it's been 2 years since the coronavirus started.
Yeah, that's crazy. I never got to see anyone, really. I was cooped up in my home for literally months. Just didn't see anyone except my parents. This year's been terrible.
I'm sure it's terrible for like all of us too.
Learning online was obviously a major source of stress. Digital access is not a given in low-income communities. Not everyone has a computer. Not everyone has adequate internet connections. Many immigrants struggle with language barriers, and many parents do not know how to navigate the internet, so they can't help their youngest children. All of this combines to create an especially stressful and frustrating learning environment.
When it happened last spring, we turned around from in-person classes to online classes between the winter and spring quarters really quickly. So it's been a big adjustment.
At the beginning, it was weird because we had to use Zoom to contact our teachers and classmates, and we had to use weird websites to do our homeworks.
I slowly got less motivated to do my work because it was just the same thing every single day where we just wake up at 9, get on the computer, and then go to class.
I was not happy because I was isolated. I was stressing with my assignments.
For students and faculty alike, but especially students, issues of connectivity, poor internet, slow internet, that makes it difficult for them to be participating fully online during classes.
In the middle of my Zoom classes, the Wi-Fi disconnects and I disconnect from my Zoom class for about 30 minutes, then the Wi-Fi comes back.
It's like an endless cycle basically, and there's nothing much I can do about it, so I just had to deal with it.
My work hours, the 9 to 5 thing, that completely went out the window. I mean, I was working crazy hours.
While lockdown was necessary to protect ourselves and others, the isolation presented many psychological challenges at Yesler Terrace. Large immigrant families with children ages preschool to high school suddenly found themselves stuck at home, together all day. Older children had to help their younger siblings while keeping up with their own homework. We didn't see our friends, and youth activities at Yesler were closed down. Isolation gave us too much time to think, amplifying stress, anxiety, frustration, fear, and depression.
My name is J.C. Coleman. I'm the Youth Engagement Specialist. I serve Yesler Terrace and High Point. It's just been a challenge in general, connecting with people and trying to meet holistic needs of community. Most of the work this far has been responsive to basic needs. So we do, like, if you look around, there's like laundry detergent and sanitizer and garbage bags and diapers, and we do food deliveries and pantries and things of that nature. So a lot of the work hasn't been directly engaging with youth thus far.
My name is Sadia Hamid. I'm the Education Engagement Specialist, work for Seattle Housing Authority. If you talk how this affects kids, because I'm the Education Engagement Specialist, it affects kids a big way because they cannot do, this is not their normal, and they're being pushed to stay in a confined place and not move out. So socially and emotionally, it's been hard because they cannot get out, they cannot meet with their friends, they cannot do what they do regularly.
You know, folks are just now starting to get comfortable being outside again. But primarily that youth are bored and there's not a lot of programs currently to engage them. So we're just looking for ways to make sure that we have safe things for them to do, like in the parks, you know, healthy things to, you know, get their blood flowing, fitness activities, wellness activities, things of that nature. But primarily that, you know, youth are bored and they're starting to do things that they, you know, probably shouldn't be doing in neighborhoods, but it's our responsibility to make sure that we have alternatives for them to do and not point the finger at this time.
Well, because of COVID-19, like when COVID started hitting, like we didn't really go to school. It wasn't even, the things that we were doing was limited. So I personally had a lot of time to kind of think and reflect on myself, and I'll say that just sitting and thinking is not really good because it kind of brings back a lot of memories. And me, I had to sit and I had time to think, so I was just getting the flashbacks, the things that I really wanted to forget a long time ago. So I was like, I need to go to the hospital, I need to see a psychologist.
What I found out is like we refer our families to maybe counselors or therapists from here.
And then I went to a psychologist, and my dad was not supporting it because, you know, it won't really help. That's what I said, but I was like, okay, let me just try it.
Because when we have different cultures, different understanding, different way of coping, different way of doing things. And when your culture is different than the bigger system or the mainstream, you don't fit in anything that comes through there.
So my name is Christy Lee. I'm a faculty member in the Clinical Mental Health Counseling program at Seattle University. There are many shortfalls in providing high quality and culturally responsive counseling services to underserved communities. One certainly is the cost. So cost can be prohibitive. Again, especially if you don't have health insurance, it can be really expensive. Another shortfall is who we train, who comes into the profession of counselors. So for example, in our program, our counseling program at Seattle University, I think we have about 25% students of color, which is higher than other places, but is not high enough. Again, because we want to train people who then will return and work in their own communities. That's a much stronger and more culturally adaptive way to provide counseling services. So that's another thing, is training more counselors of color, training counselors with different gender identities, with different nationalities, who speak different languages so that they can provide services in different languages. So that's a really important part as well. And then the third thing I would say is where is counseling physically available for people? So if a counseling clinic who has somebody who you would feel comfortable with, but they're working way across town, that might not still be accessible for you. So making sure that there are counseling services available where people can get to them, or providing counseling services through telehealth platforms, so video conferencing, that can make it much more accessible as well.
We have confronted many different kinds of loss over the past year. Some of us have lost loved ones, others suffered health issues because of COVID. We also lost the interaction we had with our friends, schoolmates, and relatives. As we look back at the last 18 months, we should reflect on and take time to grieve our losses.
I lost a lot of my friends my junior year.
Time with my family.
The chance to say goodbye to 2 graduating classes of students.
Motivation.
It's a whole year of time with my family.
My junior year with my friends.
The chance to be with people that I work with in person, and I really miss that. I'm looking forward to hopefully doing that in the fall.
While making this film, we've learned about the many changes and challenges faced by our community during the pandemic. Not surprisingly, COVID highlighted economical and racial inequalities that have always existed. Issues such as digital access and literacy, culturally appropriate psychological services, youth educational programs, and access to space for youth throughout Yesler Terrace have always presented challenges. We should recognize the interconnectivities of these issues in relation to the mental well-being of Yesler Terrace residents. But we've also learned about the strength and resilience of our community. Over the past year, we did not give up. As society recovers from the pandemic, we see an opportunity for our area stakeholders such as Park and Recreation, Seattle Housing Authorities, Seattle University, and other non-profit entities to work with the youth and families at Yesler Terrace. Together, we can creatively address these and other issues towards a better than ever Yesler community.